student nurse practitioner today. Can you verify your name and date of birth for me?
Kevin Westgate, 12980.
Perfect. Do you know what day of the week it is?
April 25th.
Oh, perfect. About what time of day?
4:30.
Awesome. I'm going to start off with just doing a little evaluation of your head. You're going to feel me touching. We're just going to inspect hair distribution. Make sure there's no wounds, looking for nevi. We're going to palpate. Make sure there's no trauma, any wounds, lesions. Perfect. Just going to check your skin.
Mm-hmm.
Face is smooth, it's symmetrical, it's pink, it's warm. Sorry, I'm just gonna move into looking at your eyes. You can go ahead and just look at me.
Mm-hmm.
I'm gonna start off by a direct checking pupillary response. Perfect. I'm gonna do the same thing, checking the other side for consensual response. I'm gonna try the other side. Direct, one more time, consensual. One here, I'm just gonna pull down on your lids.
Mm-hmm.
They're pink, they're moist, they're intact, sclera is clear white, no drainage. Eyelids are symmetrical, okay. Eyebrows and eyelashes are no abnormal distributions. Sorry. I'm gonna go ahead and take a look. So I'm gonna start off at 0, I'm gonna stabilize. We're gonna come in and find the red reflex. And then from there, we'll dial the diopter up. You can just look behind me, that'd be perfect. I can't do this in the day of light, but normally we would take a look on both sides, looking for disc margin, making sure it's yellow, it's clear, checking for AV nicking, which is significant of cardiovascular, the white clouds or white spots, which are lack of oxygen, and the copper wiring, which is again cardiovascular disease. I'm just gonna have you take a look right out here. Check the reflexes of the pupils, they're midline, bilateral, symmetrical, no crescent moon, which would be indicative of glaucoma. Perfect. I'm just gonna use my pen. If you can just follow this in, I'm just gonna check convergence. You should be able to get to 5 to 8 centimeters. Perfect. Now look at my pen and then look behind me out here. And then look at my pen. Perfect. And I'm just gonna check extraocular movements. Cranial nerves 3, 4, and 6. We're also checking for symmetrical movement, double vision, nystagmus. Perfect. We're gonna move into the ears. Just gonna check symmetrical pinnacle, the lobes, tragus, pink, warm, moist. There's no drainage. No wounds, no lacs, no lesions, no moles. I'm gonna start off with your left side. Just gonna inspect the ear canal and stabilize. Ear canal is clear. TM is intact, pearl and gray. Tone of light is at 7 o'clock on the left. Able to visualize bony prominences of the incus, malleolus, and stapes. And again on this side. TM is intact, pearly gray. Cone of light is at 5. I'm just gonna, if you could just clench down and relax. There's good movement. It's part of the trigeminal cranial nerve. Go ahead and take a look at your nose. If you don't mind tipping your head up just a little. You're gonna feel me touch, and I'm just gonna stabilize. Just checking for any drainage. It's pink, moist. Septum is intact, no perforation. Inferior and no turbinates visualized. And again on the left. Clear and intact, pink and moist. I'm just going to take a little inspection of your mouth. just gonna start by looking first. We're checking gums, teeth. Gums are pink. They're intact. No sign of dental cavities. Posterior pharynx is midline. Uvula is midline. You lift your tongue up. And move your tongue to the left, to the other side. Perfect. There's no wounds, lesions. Lips are pink and moist, non-cracked, symmetrical. That also tests. We would do the gag reflex for cranial nerve 10, but we will pass. 9, cranial nerve 9 has to do with tongue movements and uvulae and the posterior palate moving midline. Perfect. From there, I'm going to check some sensations on the face, which comes back to cranial nerves. We'll just start with some dull and some sharp and some facial nerve. Tell me if it's sharp or dull.
Dull. Sharp. Dull. Sharp. Sharp. Dull.
Perfect. I'm just gonna list this near your eyes again, checking for cranial nerve. And blink. And blink. Thank you. Alright. I'm just gonna check for some lymph nodes. Periaurical, postaurical, anterior cervical, posterior cervical, occipital, submandibular, submental, superior, and inferior. I'm just going to lift your arm. You can relax. Checking for axillary nodes. I'm just going to hold your arm up for you. Perfect. Nodes are non-tender, no nodules, non-palpable, which is a normal. I'm going to go ahead and go behind. I'm going to have you shrug your shoulders so we can check your spinal accessory muscles. Go ahead and relax. Go against me. Perfect. There, +5. Checking cranial nerve 12. I'm going to have you push against my hand. Push against my hand. +5. Strong. You can relax. While I'm here, I'm going to check for the cricoid. I'm going to palpate. Trachea is midline. Thyroid is intact. I'm just going to push a little to the side. Thyroid is clear of any nodules. Appears symmetrical. Can you go ahead and swallow for me? Mobile, non-tender. Perfect. Alright, I'm going to have you go ahead and lay back. Can you take your shirt off for me if you don't mind?
I'd love to.
So now we're going to take a look at the carotids. And we would imagine you're flat. I'm just going to start with inspecting. Do we see any pulsations? The neck skin is intact, it's symmetrical, it's pink. I'm going to palpate with one hand at a time. Upstroke is brisk, it's smooth, +2. I'm going to try the other side. Perfect. Smooth, brisk. I'm just going to take a quick listen while I'm here, checking for any bruise, swooshings, indicative of any narrowing or clotting. Go ahead and take a breath in and hold it. Relax. Go ahead and take a breath in and hold. And relax. Good. No bruise or swooshing upon auscultation. While you're here, I would imagine that the bed is at 30 degrees kind of simulating that a little bit. We're gonna check some JVD at this point. We're gonna go, we have the sternocleidomastoid muscles. We follow them down and look for the internal jugular. And at the peak, we're gonna come across. We're gonna put the corner where we can visualize the pulsation. And on the sternomastoid, we're gonna bring this across. That puts us at probably about, sorry, 2 centimeters. Which it should be less than 4. Anything greater than 3 to 4 centimeters would be indicative of increased right arterial pressure or hypervolemic, often found in CHF. While I'm here, I'm just going to inspect the chest. We don't see any heaves. We have symmetrical rise and fall. No accessory muscle use. No thrills. Skin is intact, symmetrical rise and fall. We come down to about the 5th intercostal space. We can check for PMI, probably about centimeters from the sternum. It's right there, probably about a quarter in size. We'll note for that. I'm gonna go ahead and just percuss while I'm here. Kind of take note of some dullness of where the cardiac borders are. It's probably from here to there. You say 99.
99, 99, 99, 99, 99, 99.
Perfect. We have positive tactile fermentus, which is great. No evidence of extra air trapping and no fluid. And while we're here, I'm just going to take a listen. I'm going to start listening to heart sounds first, and then we'll move into lung sounds. I'm going to start with the diaphragm, making sure we hear S1, S2, no murmurs. Start at the aortic, probably about the 2nd intercostal space. Pulmonic. Move down to Erb's point, probably about the 4th intercostal. Tricuspid. And mitral, right over the pulmonary. I can hear an S1, S2. I'm sorry. And then go back and listen with the bell, same thing. Go ahead and just turn on your left side just a tad, please. Just gonna turn and listen. Checking for any S3 or murmurs at the mitral valve, which is common in CHF. Go ahead and turn back. I'm gonna go ahead and listen to lung sounds. If you can take a breath with your mouth open, please. You can breathe normal. Lung sounds are clear. No adventitious sounds. The vesicular. Just gonna go ahead from there and have you sit up. I'm just gonna listen to your heart one more time with you kind of leaning forward a little bit. Thanks. Take a big breath in and hold it, please. And relax. Again, checking murmurs. And I'm gonna go around to the back and inspect the lungs. I'm just gonna palpate, check for any pain. There's symmetrical rise and fall. The skin is pink and warm and intact. There's no holes. So I'm gonna palpate down the spine. Let me know if there's any pain. Spinous muscles are good. Spine is intact. I'm gonna have you say 99.
99, 99, 99, 99, 99, 99.
Positive for tactile fermentis. No evidence of COPD or fluid pleural effusions. Percussion is clear. You can go ahead and take a listen while I'm here. If you can just take breaths in with your mouth open. this?
Nope.
Any pain over here?
Nope.
No CVA tenderness. Lung sounds are clear. They're vesicular. No adventitious sounds. If you can go ahead and lay back again, please. And go ahead and bend your legs up. Switch it, please. Clear your belly. I'm gonna check the skin. It's pink. It's intact. There's no pulsations. There's no hernias. There's no discolorations. No bulges. I'm just gonna go ahead and take a listen. You can hear 5 to 30 bell sounds per minute. Be normal. Okay, I'm just gonna take a listen. Your renal artery rhythm here. Arteries are clear, bruise or any swishing. Abdominal aorta is clear of any bruise or swishing. Just gonna do a light palpation, okay? Abdomen is soft, non-tender, no nodules, no bumps. I'm gonna go a little bit deeper. You have the femoral and inguinal, no lymph nodes. And try and palpate the aorta. The aorta should be less than 3 centimeters. It's good. I don't think we're taping. Yeah. Just gonna do some panic. No evidence of organ or fluid. I'm gonna palpate midclavicular line. Do some percussion to the liver. Notice some dullness. We'll mark it from there. We can take a look. Should be less than 12 centimeters. Over here should be 4 to 8. Over here we would do the mid-anterior axillary line. I'm gonna go down, just trying to palpate spleen or kidney. Take a breath in and hold. This is Traub's area. Go ahead and release. Just gonna try kidney or spleen are non-palpable, which is normal. And do a liver. Liver's about 1 centimeter down, smooth edges. Great. All right. I'm just gonna check cranial nerves, any that I missed. Cranial nerve 1 is olfactory for smell, which we can pass. I feel like we're patent. Can you breathe okay on each side? Perfect. We checked cranial nerve 2 with the optic, with checking pupil response and doing the fundoscopic. We checked extraocular 3, 4, and 6 with extraocular movements. We checked trigeminal with bite and sensation. We checked We did not do any facial expressions. If you want to sit back up for me, please. Take a look at me, smile, puff out your cheeks like a blowfish, eyebrows up, close eyes nice and tight. That's facial nerve. You can relax. That is intact. I'm gonna whisper behind your ear, and you can tell me if you hear me, or you can repeat what I'm saying.
Okay. ABC.
And
1, 2, 3.
perfect. Acoustic nerve, it's intact. If it wasn't, we could do a Weber or the Rennan test. Ooh. We checked vagus and glacial with the tongue. We checked 11 of spinal accessory and 12 is the tongue movement. I'm just going to check skin at this point. Just going to take a look at the upper extremities. Shoulders are symmetrical. There's no atrophy of the biceps or triceps. Forearms. Skin is intact, no lesions, no moles. Hair distribution is equal. No unusual patterns. I'm going to have you squeeze my fingers nice and tight. I'm going to have you try and pull towards you. Now push away. Perfect. You can relax. Biceps and triceps are intact. They're a +5 on the strength. I'm just going to palpate pulses. And they're a +2, smooth and brisk. Brachial. Good. Your legs up, you're fine. Just checking popliteal. Perfect. And you put your arms out to the side. Bring them up. Bring back down. Bring them in. Rotate out. Rotate down. Any pain with that?
No.
Shoulder muscles are intact. +5. Take a peek at your hands. We have less than 3 sec cap refill. Skin is intact. They're warm. Pink, moist, no discoloration. No wounds, no lesions. From there, I'm just gonna check real quick. Is it sharp or dull? Is it sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Okay. No noticing of scars. Why don't you go ahead and lay back again? Take a look at your legs. Go ahead and relax that leg down. Again, we're just going to compare, look at the skin is intact. No significant scarring. Hair distribution is normal. Color is pink. It's warm. Calf feet full. Cap refills less than 3 secs. Pulses +2. Dorsal, post-tibial +2. Popliteal, very good. Go ahead and lift your leg up against me. Good. Relax. Go ahead, lift your leg. Relax. Lift it, push against me. Good. And push against me. Good. I'm just going to move in and go that way. And we're going to go externally. And then I'm going to straighten. Good. While in here, I'm going to just check lateral and medial. Good. Other side. I'm just going to go in, internal rotation, external rotation, out, straight up. Muscle strength is a +5. No signs of atrophy or bulking. Their tone, it is appropriate. While you're there, I'm just going to sneak your arm and go ahead and relax it
Mm-hmm.
as best you can. I'm going to do tricep reflex, radial, and Go ahead and just relax your arm. Do a tricep. Radial. Relax that arm in your foot. Just relax. Reflexes are a +2 symmetrical. Can you mind sitting? I'm just gonna lift your leg.
Mm-hmm.
Go ahead and relax it. Good. Good. Go ahead and relax. Good. Go ahead and bring this ankle's leg over. I'm just gonna hold. Ankle brachial. And I'm just gonna hold. All reflexes are +2 symmetrical on each side, which is normal. From there, if you don't mind, putting your arms out in front of you, and palms up toward the ceiling. Close your eyes for 10 seconds. Just checking for pronator drift, which really could happen in strokes. Good. You can relax. And you can stand up. Walk to me. Normal swing, gait without difficulty. Come back, doing a heel to toe. Perfect. Stand there for 1 sec. Close your eyes. Lift one foot up. Lift your other foot up. Just stand there.
Okay.
Go ahead and bend over at the waist. Come back up. Twist. Top half. Twist the other. Rotating. Reach down on this side. Reach out on that side. Perfect. While you're up, I'm going to have you stay over. Just back up for 3 feet. Thanks. That's about 6 feet on this visual acuity. Go ahead and close one eye. And tell me the smallest line you can read.
CFDHJ.
Perfect. It's 20/30. Close your other eye.
LTFPH.
Great. 20/30 without any corrective lenses, which normally should. Doesn't have to wear, but does wear. You can go ahead and have a seat. And then I think we covered everything.